Leprosy is an age-old disease described in the literature of ancient civilizations. Throughout history, affected people have often been ostracized and stigmatized by communities and families.
Leprosy is a chronic infectious disease caused by a Mycobacterium leprae, an acid-fast, rod-shaped bacillus. The disease mainly affects the skin, the peripheral nerves, mucosa of the upper respiratory tract, and the eyes. Leprosy is curable, and treatment at the early stage can prevent disability. Leprosy is a chronic granulomatous infectious disease caused by a Mycobacterium leprae. Leprosy is one of the oldest diseases in existence.
Leprosy is a chronic infectious disease caused by a bacillus, Mycobacterium. It is also known as Hansen's disease.
Mode of transmission. The major route of transmission is by droplets. This is based upon the fact that organisms have been found in nasal secretions and throat secretions of the lepromatous type of leprosy patients, like an open case of pulmonary tuberculosis. The other usual mode of transmission is by direct skin-to-skin contact with the ulcerative lesions of leprosy patients. The bacilli may also be released through lesions by trauma, superadded infections, and exacerbated skin lesions observed during lepra reactions. Prolonged close contact with someone with untreated leprosy for over many months is needed to catch the disease. You cannot get leprosy from a casual contact with someone who has Hansen's disease, like shaking hands or hugging, sitting next to each other on the bus, sitting together as they meal.
The indirect mode of transmission of disease through fomites are based upon the fact that the organisms are capable of surviving outside the body for about 8 to 10 days.
Risk factor of disease. Overall, the risk of getting Hansen's disease for any adult around the world is very low. That is because more than 95% of all people have natural immunity to the disease. However, someone could be at risk if 1. You live in a country where the disease is widely spread. 2. You are in prolonged close contact with people who have untreated leprosy disease. However, as soon as patients start treatment, they are no longer able to spread the disease.
Symptoms mainly affect the skin, nerves, and mucous membrane. That is, the soft, moist area just inside the body organs. The disease can cause the following signs and symptoms. 1. Discolored patches of skin, usually flat, that may be numb and look faded. That is, the affected area will look lighter than the skin around. 2. Growth or nodules on the skin. 3. Thick, stiff, and dry skin. 4. Painless ulcer on the sole of the feet. 5. Muscle weakness or paralysis, most especially the hand and the feet. 6. Numbness on the affected area. 7. Stuffy nose. 8. Nosebleeds. If left untreated, the signs of advanced leprosy include paralysis or crippling of hands and feet, shortness of toes and fingers due to reabsorption, blindness, loss of eyebrows, and nose disfigurement.
Other complications that may sometimes occur are painful and tender nerves, redness and pain around the affected area, and burning sensation in the skin.
Leprosy disease can be recognized by the appearance of patches of the skin, which may appear lighter or darker than the normal skin, and sometimes affected skin areas may be reddish. Loss of feelings in these skin patches is common, as individuals may not feel a light touch or a prick with a needle. To confirm diagnosis, a sample of the skin through skin or nerve biopsy is taken to view the bacteria under the microscope and to rule out other skin diseases.
Treatment of leprosy. Leprosy can be treated with a combination of antibiotics. Typically, 2 or more antibiotics are used at the same time. This is dapsone with rifampicin and clozapine, which is added for some type of disease. This is also known as multi-drug therapy. The strategy that prevents the development of antibiotics resistant to the bacteria may otherwise occur due to the length of the treatment. Treatment may last for about 1 to 2 years. The illness can be cured if treatment is completed as prescribed.
Some preventive and control measures of leprosy are as follows. early detection and prompt treatment of disease to limit disability and spread, avoidance of prolonged contacts with infected persons, isolations of infected persons, environmental and personal hygiene, health education and promotion.
Having established the fact that leprosy is curable and treatable with early detection, it is your responsibility to keep your health at a proper check. Give adequate attention to your health.
Keep your environment clean. Whenever you notice something strange on your skin, contact your healthcare providers immediately.